I'm Lila Johnson. This is Honolulu, Hawaii. Right now we're at the State of Hawaii Department of Public Health. That is my day job. I work here as a health educator. I am a community coalition coordinator for the state. I'm in the Tobacco Prevention Education Program, and what that means is I create coalitions that address tobacco control all around. Tobacco control is now my passion because it's the #1 public health problem. It's one of the most preventable forms of causing death and disease. My evening job is volunteerism, and it's basically with the American Cancer Society. I have been a volunteer with them for 34 years, and I've been fortunate to serve in the American Cancer Society at the local level, the national level, and the state level. Next week I'm going to become the National Secretary of the American Cancer Society. So it's all these years of volunteering at the level, so it's really neat. So we've had a president. It was back in 1999 of American Cancer Society from Hawaii, and so I will be the second officer from Hawaii. So it's really jazzy. Well, we are the State Department of Health, so that means we impact the entire state. What we are able to do, and because of our program, we're a CDC-funded, federally funded program that has a lot of different components. And one of the strong components is working with the community. And I am the lucky person to have the job of working with the community. And so what we've done is we've created community coalitions. I've hired contractors we only have 5 of them right now. We have 2 on the Big Island, which is the island of Hawaii, 1 on Kauai, and the position is open on Maui right now. By paying them to collaborate in their community, bring the organizations together, they impact tobacco control. They're the ones that make us look good because they make it happen. They enact ordinances at the county level, and those ordinances build up, and we're able to enact state laws. With tobacco control, there are basically 4 areas that we look at, and it's to prevent young people from beginning to smoke, to eliminate exposure to secondhand smoke, to promote tobacco cessation or quitting smoking from both youth and adults, and then it's a 4th one, but it basically covers everything, is to look at populations that are disparately affected by tobacco control. And so what we do for our contractors is ask them to address each of those areas. They're giving funding to do projects. They bring their community together, and they do amazing things. At one point we were 3rd lowest in the country. We're about 5th lowest now. Our tobacco use is 15.4%, which is really very good. National average just dropped to 19%. It had been about 20%, so we're at 15.4. Utah's #1, California is 2nd because they've had many, many years of tobacco control efforts, and there are a couple others that are ahead of us. Okay. We used to be #3, so we don't like to think about those 2 that are there, and they probably watch and are not very happy. I believe it's Connecticut, and it may be Colorado.
That are in the lowest use of tobacco. This is
the lowest use of tobacco, so we're really proud of that, and we have very good laws. You cannot smoke in any work site, bars, restaurants, or nightclubs. We have a very high tobacco tax, and like I said, we've got this community effort. People are out there doing their work in their own communities, and we provide training to help people quit smoking. So I had thought, maybe I should get a master's in nursing, but I really liked, as I said, the prevention piece, so I checked out the School of Public Health, and going back to school was wonderful. I thought, I love this stuff. This is what I've been doing. Basically, in the seat of my pants, I've been doing it intuitively, and there are theories. There are actual theories that validate what you're doing and why people change behavior, why things happen. But you also learn there's a real difference between a medical model and a public health model. And the medical model is what nurses and doctors do. They treat a patient one at a time, deal with their illness, whatever their particular needs, or might be a well patient. But with public health, what you're doing is you're impacting communities, you're impacting the state. When this job was offered to me, because it was after I came back from CDC, and because before that I'd been a professional volunteer. You know, I was with my son's schools. I was on the PFA board. I still sit on a number of other boards in the community, the junior league. Well, I don't sit on that, but I chaired that and was president. But I said, okay, I'll do this until it stops being fun. And there are days, but our job's not done. We still have more to do. We have populations. I'm particularly concerned about tobacco and women, because our teenage girls are not stopping. Many of them are still very interested in, they're still enticed by smoking. I like the balance. If all I had were working for a government entity, I think that would be very frustrating. Being able to volunteer, being able to do lots of things as a volunteer. I believe so much in volunteerism, as I said, you know, because ACS is my major organization, but I also sit on the boards of the Friends of the Medical School and the Friends of the Cancer Research Center. A friend of mine has created a new organization for chronic obstructive pulmonary disease, and now I'm on that board. You ask why I did the balance, because I get such joy out of being able to do something like that, and it does reflect on what I think. Then I came back, I'm offered a position to work with the communities. I'm going, this is terrific, because this is some, you know, philosophy I've been espousing. Now I get to try to make it go to work. You owe humanity. I mean, look how much we've been given. To be able to turn around and say, I want to do something and I don't want to be compensated for it financially, because I can't say that I don't receive anything back. I just receive such joy and satisfaction. You know, I'm thinking I should pay them for allowing me to do this. So I truly believe in volunteerism, and just taking every opportunity. You learn from it, you grow from it, and there's lots of stuff you can do.